Hello everyone, I am Dr.Seema Gaonkar. I am a consultant neonatologist and pediatrician working at Cloudnine Hospital, Sahakarnagar. I have done my MBBS from Mahe University and MD Pediatrics from Mahe University. After that I have done my neonatology fellowship from the Cloudnine Hospital itself. So the fontanelles are the soft structures or soft spots what we say in the skull, and these soft spots usually close at their particular timings, but whether they are flat or they are sunken or they are bulging, most of the time they are flat. And if you touch the baby spot, sometimes you feel something is pulsating there, which is normal. The pulsatile fontanelle is normal, nothing to worry about it. But yes, are they sunken or are they bulged? Sunken, sometimes mild sunken is common and usual in many of the babies, but in general, severely sunken or before flat one suddenly becomes sunken is a sign of dehydration. Dehydration means reduction in the hydration or water content of the baby's body. Either baby is not fed well or lost it in the diarrheas or excessive urination. Any of those reasons can cause dehydration in the babies. So one of the signs for this dehydration is fontanelle becoming sunken. Other signs are there, as you know, urine output will reduce and the baby will be very dry lips, dry tongue, baby will be agitated or irritated, crying, all these signs are also signs of dehydration. So how to treat it? Obviously you have to take the baby to the doctor immediately, and they have to assess the baby whether it is a normal thing or an abnormal thing. If it is a dehydration, how to treat it? The doctor will know how to treat it. They will do the accordingly assessment, the reason for it, and they will treat the baby. Same way, the bulging fontanelle. Bulging means the fontanelle is come above the level it's supposed to be flat. When the baby is crying or sometimes baby vomits, you may feel suddenly there's a bulge in the fontanelle, which is a normal thing. But if it is constantly bulged fontanelle, is it significant? Yes, it is significant. It tells us that baby has raised or increased intracranial tension, what we say. That means inside the brain, cranium means brain, the baby's brain has a more tension inside it. Why there should be more tension inside the baby's brain? There could be several reasons. Some reason could be the infection, like what we say meningitis. The covers of the brain are infected, or the brain itself is infected, like encephalitis, or sometimes it could be bleeding in the brain. There are many sites where the bleeding can happen. It's in the layers of the skull covering the scalp, what we tell, or it could be inside the brain bleeding. So these also can increase the pressures in the brain, the cavities of the brain. The brain has not only structures, it has cavities also. So when these structures will be built, filled with the fluid or blood, or the pressure has increased, then this fontanelle will naturally has to bulge up. That is the pressure point for them, that bulges up. That's only a sign. There are other signs also along with this, which can be telling you, because baby will be vomiting, cranky, the eyes will be bulged out, baby will have so many other like abnormal movements, fits, what we say. So these can also be associated with the bulging fontanelle, or a fever child if it's an infection. So immediately when you think these signs are associated and you think your baby's fontanelle or the soft site is not looking normal, immediately go to the doctor and they'll do the needful thing.